There are a lot of misconceptions about eTMF technology where small life science companies are concerned. It's too expensive, comes with too many unnecessary bells and whistles, and is extremely complex to integrate. So for these small companies, it really comes down to one key piece of guidance. Keep it simple. So today on the State of TMF, our expert panel is going to discuss all things eTMF with life science companies in mind. From how to select a vendor to making sure you have robust processes in place to support your new technology. eTMF tech should help you bring treatments to patients faster, not complicate the process. The State of TMF is officially in session. Let's get into it.
All right. Welcome, everyone, to another episode of the State of TMF Live. We've got a really interesting session today, so I'll let everybody fold in. We're going to be doing a bit of a panel-style discussion on a really interesting topic. If you guys have questions throughout, please throw them into the chat. We'll try and tackle them as we come. Just maybe a brief introduction. So for those that don't know me, my name is Oliver Pierce. I'm a Director of Growth Marketing here at Montreal. Maybe I'll let my co-hosts introduce themselves. Paul, do you want to maybe say a few words?
Sure. Hey, everybody. Nice to see you again on this latest episode. I'm Paul Fenson, CEO of Montreal. Getting towards being a veteran now, I think, in the TMF space. I'm really excited to talk about TMF technology and where it's come from, and more importantly, how it can better support maybe smaller organizations. So,
Hi, Christina.
Hi, everyone. Nice to see you. Everyone, our guests on the podcast today. My name is Christina Menziros. I'm the head of clinical solution strategy at Montreal. I have a background in clinical operations. Been at Montreal for about 6 years now, and excited to join again today and discuss about eTMF tech for small organizations.
Exactly. Thank you. So just to kind of remind everybody of the subject of today's discussion, there won't be a presentation. It's really an open format for us to just have a discussion around a topic that we think really needs to be addressed in the industry. And the title of today's discussion is eTMF technology working for smaller organizations? So we're going to tackle a lot of different subjects. We're going to start by going back into the past a little bit and talking about where we've come from, and then also maybe hopefully finish with where we hope to be in the future. So maybe we can sort of just kick off the discussion in an area that I think will remind those that have been in the space for a long time, especially yourself, Paul, about sort of where we've come from a TMF technology perspective. So would love just to pose the question, when we think about eTMF technology as it is today, it might be quite different from where we originally started. Even some of the software vendors that were once maybe entering the eTMF space all those many years ago are no longer here anymore, and that technology has changed. Paul, what have you seen over your tenure in the TMF space?
So when I first started my career, I was in data management, and it was kind of the beginning of EDC. So this is like 1999, 2000. Yeah, we were still using modem to transfer data from sites and stuff like that. EDC then really sort of took off and became very mainstream by about 2010. And obviously leveraged better connectivity through the internet. I think that TMF has sort of, or is following a similar trajectory. So when we look at eTMF 10 years ago, number one, there wasn't that much of it. Number two, we didn't always call it eTMF. Quite often we used to call it, like the regulatory repository or the regulatory management system. And it was all about documents, and it was all about archiving and having a place where we could safely store electronic documents, which was starting to become more and more prevalent in our environment. But we were still also very much in a paper world. Now, the companies that were sort of pioneers in having eTMF systems were the larger companies, and they were using systems like Documentum, right? Everyone had Documentum. It was kind of the main system. It was a bit like Oracle Clinical in the data management world at the beginning. Everyone used Oracle Clinical. It was the same kind of thing. This big piece of software. It was all on premise. It was extremely expensive, not only to purchase licenses, but also to install, because you had to install it on premise. So you had to buy all these servers and qualify them, and then install them, and then qualify that. And they configure it, and then qualify that. And it was just a very, very long, drawn out process. And I was involved in some of those projects, more as a consultant, and it would take years. It would take years to put it in place. Crazy. And at the end of the day, what we had was really just a document repository that was compliant, that allowed us to search for documents, to put in place a certain structure. But it wasn't that much more than a file share. And there was a bit of workflow, but the workflow tended to be kind of clunky, and quite difficult to implement. There are other systems out there as well, like LiveLink, that was also kind of similar to Documentum, being used maybe by smaller organizations. And then there was also FirstDocs, which I'm not sure what happened to FirstDocs, but it was also kind of one of the front runners to start to put in place eTMF technology. But for smaller companies at the time, it was kind of impossible to put that kind of thing in place, because it was just too much work and too expensive to be able to put such a system in place. And so they tended just to stick with paper.
Yeah. No, I think that's what, especially the last 10 years that I've been in this space, even when I first kind of entered the TMF space, the technology, like you mentioned, the Documentums of this world and some of the sort of larger document management systems, we were dealing with, of course, a lot of on-premise deployments. So for some of the technical folks on the line, on-premise meaning that we're installing that software, at your company on a server, on a machine. And inherently that brought along with it a huge amount of IT burden, a huge amount of complexity, right? You needed larger teams to be able to implement that. Validation became a much, much, larger part of that project. And it wasn't too odd to see implementations of those early eTMF systems taking a year and a half, 2 years, or even longer, depending on what you were trying to achieve. And I think that really prevented smaller organizations from gaining access to that technology, right? And I think ultimately that's when we started to see SaaS solutions start to come into play. One of the questions I always have for myself is, the promise of SaaS was that it would lower the barrier to entry for smaller organizations because there was a shared responsibility with your vendor. You didn't have to install anything at your organization. It was all web-based. We could streamline this and streamline that. Question I have is has that barrier been lowered enough? I'm curious to hear what my co-hosts have to say about, the promise of SaaS and whether we've lived up to that promise.
I mean, like Christina, we just got the answer to that.
Well, I think that an interesting thing that has happened in the eTMF world is that even just when I joined Montrim, I came to Montrim from an organization that was using paper TMF, and that was just, a little over 6 years ago, right? And then I remember thinking, like, we're still not seeing a lot of companies adapt to an electronic TMS. People are still trying to use, hybrid in-house file share, or even still using paper. But today we do see that there's the majority of organizations, even smaller organizations, that are looking to purchase an eTMF and are interested in electronic systems. So in that sense, that it's gained a bit of popularity, but I do see that the barrier to entry is still not low enough for smaller organizations, in that sometimes they don't understand exactly what they need in eTMF functionality. It could be something that's very simple, right? Where they're looking for simple workflows, or potentially not even looking for workflows at all, right? They're just a place where they can file their documents simply, that it's organized, it's in a validated system, it's easily retrievable. And so in that sense, I think that there's still a bit of a barrier for companies who are not totally understanding exactly what they're looking for. And again, the onus is also on eTMF vendors to be able to advise those smaller organizations on the type of configuration that they need.
Yeah, absolutely. I think obviously that promise of SaaS gives us that ability to, we're moving from big annual cost to implement on-premise software to sort of monthly subscriptions, the kind of Netflix style approach to software. But in reality, maybe we haven't really got there yet from an industry perspective. I think, Paul, you and I talk about this all the time. You now there's so much technology on offer to sponsors, to CROs, to clinical teams that are looking to implement systems like this. You could throw a rock and hit 10 eTMF vendors. But the challenge still remains, I think, that, over the last, since those systems have been implemented, costs haven't necessarily gone down all that much, and they've continued to creep up in recent years when it comes to implementing that technology, just purely from a cost perspective, right?
Yeah. I mean, I think that when we look at most of the vendors out there, the implementation phase is quite comprehensive because they're trying to cover a lot of different functionality. And in reality, and we actually got some metrics on this. We looked at our client base and we looked at size of client and use of system features. And we realized that a lot of the really small clients actually use a fraction of the system features, and yet they still went through onboarding for the full set of features, which requires a lot of time in training and user acceptance and all of that stuff. Of course, you pay for that. There's always a cost to that. And so one thing that we realize is that, well, maybe we need to sort of adjust the offering a little bit. So it's more aligned with the features that they truly use. And I also think that when we look at smaller organizations, quite often they're working with a third party, right? They're working with CROs, and the CROs are doing a lot of the stuff. And so in reality, their use cases are fairly limited. They need to be able to ensure the long-term retention of the records. They need to be able to go through an inspection with those records. They need to have oversight. But there's a lot of stuff that's being done by the CRO. And so maybe there's an opportunity here to come up with something that's a little bit more pared down, more aligned with their specific needs, and also more affordable, because we're not spending as much time onboarding and supporting those clients because they have such a limited use case. And so I think that's something that we don't see necessarily in all vendors across the industry, and I think is something that is needed, by this segment of companies that are really in startup mode. They're not huge companies. They're maybe in phase 1 going into phase 2, or they're early phase 2, and they've maybe got one molecule. So these are not huge organizations, and I think that today's offerings are kind of overkill. We need to come up with something better to better support those emerging companies.
Yeah. And I think that there's, you mentioned obviously the scope of use of the system as being sort of a key enabler for these smaller organizations being able to access more affordable solutions, right? Like kind of paring down and really thinking critically about what you need. I think one of the things that sticks with us internally a lot is this concept of, inspection readiness isn't achieved through technology, right? Like technology is an enabler for inspection readiness, but there's nothing in the regulation that says you need this feature and this feature and this feature from this vendor to be able to be inspection ready. And I think sometimes we get carried away in this space. We go to conferences and we speak to people and peers that have this feature and this feature, and then we think, oh, well, we need all of that too if we want to be inspection ready. But in reality, where I'm coming from here is I think the process is more important than the technology, right? Like that's the way you need to be spending most of your time and effort and money perhaps. And what you need from a TMF technology is actually something much more simple that maybe evolves over time. As your process evolves, your organization grows, maybe you need additional functionality. But I think, sometimes we bite off more than we can chew, right, to start off with.
I think that a really good point for about the system won't fix having an electronic system or an electronic system with this bell and this whistle will fix your problem. But a system will never make people more compliant to procedures. And so I think that that's a really important point. We see it with our smaller customers as well, that where we're they're saying I really need. I don't want my users to fill in this field or this metadata because it's not, they're not filling it in correctly or, whatever it may be, but it's really about it. doesn't mean that having an electronic system will replace, some of the training and the investment in time that goes into the framework of an eTMF. And so I think that's a really important point where we've told our customers, if you're trying to fit sort of a square peg in a round hole, like maybe it's time to look at your processes and see where those can be optimized as well. Because once you have an eTMF that's working for you, you might think that you want to try and fit your process. You have a process and you're trying to fit that into the TMF, where it should sort of be the opposite. Now you're changing your outlook on how to manage documents. Look at the processes again and try to optimize those so that they work for you.
Yeah. And I think that there's, like we touched on a couple of different things here, and I want to keep on this track of like, how do we make eTMF tech more accessible and affordable to smaller organizations? Like we talked about, like uncomplicating the implementation process, trying to kind of take the complexity away. Reducing the scope of how you'll use the system will have an impact on that, but also, all of the other connected costs to using software. I think there are other things, even before you implement an eTMF system, that can actually reduce the potential cost and the barrier to implementing technology. And I think a lot about how we select eTMF systems today, right? And in our kind of pre-prep call discussion, we talked about a couple different things. And one of the things that you mentioned, Paul, which I want you to kind of explore a little bit, is around audits and vendor due diligence and things like that. What are some of the things that smaller organizations can do to be able to, reduce the barrier by maybe relooking their vendor qualification process?
Yeah. So obviously, if you're a small organization, it doesn't take away from the fact that you're ultimately responsible for ensuring that the systems that you're using meet their intended use, and that you've done adequate due diligence on those systems, either through your own validation or through verifying that the vendor that you're working with has done adequate validation of that system. And so I think that number one, TMF is TMF. We've got the TMF reference model. Pretty much every single organization I know follows it. And more, that model is now moving towards becoming a standard for the industry that is recognized by regulators. And so we should not be deviating from that in the first instance. We should just be following it as much as we can. And I know that it's not necessarily perfect, and sometimes you need to have a few workarounds, but in terms of system configuration, I would not change it. I would just leave it as is. Because as soon as you start changing things in a system, it creates the need to do additional verification that the changes you made have been done properly, and that it works in relation to your process. So I definitely think, first of all, if you're a small organization, use the system as it's been defined, as it's been configured, without making any significant changes. And that's already going to reduce your burden, because you can say, well, I'm using the system out of the box. I'm not making any changes to it. And most SaaS vendors want you to use it in that way anyway, because it just makes things a lot simpler. The second thing is, you need to be able to leverage all of the work that the SaaS vendor has done, because the SaaS vendor has actually gone through and done all of the verification, done all of the testing on that system, and user acceptance testing as well, to make sure that it meets its intended use based on the requirements that were defined. And so you should be leveraging that. Now, the way to leverage that is, obviously, you need to do due diligence. And usually due diligence traditionally has been done via an audit, right? So you send an auditor. Used to be on site, more and more it's remote, since COVID. But it's still quite a big expense to actually get an auditor to review all of that documentation, and then also look at all of the procedures and the controls that are in place. So I think first and foremost, what you should do is you should speak with your vendor and say, okay, well, what can I leverage in terms of your documentation, which will enable me to demonstrate that this system meets its intended use. And so we provide access to our system documentation to our clients so that they can leverage it and show that to an inspector or to an auditor if required. Now, there's also other things that you can look at. So more and more we have certifications. today. So we have like SOC 2 certifications, we have ISO certifications. All of these things require a certain number of processes and standards be in place for information security and a whole bunch of other sort of more technical controls. So you can also leverage that as due diligence. You could say, well, these guys are certified, or at least they're on a certification path, and therefore I know that they have all of these different processes in place. I think you should also ask about, okay, well, what else can you give me which will demonstrate what controls you have in place? And so we, for example, have a document that describes all of the different controls, both within our system as well as procedural, that allow us to meet the intended use and also meet requirements of things like 21 CFR Part 11 and Annex 11. So the bottom line, the vendor, the software vendor, has done a lot of work for you. And if you use the system as it is, in reality, you don't really have to do much at all. And you definitely, I don't think, need to necessarily go on site and do an audit. You can also, you could send a questionnaire, or you can ask the vendor sometimes, and we have this, do they have a questionnaire that's already completed, a quality questionnaire that you can access? That's also something that's quite possible. And so I think you can do a minimal amount of due diligence just by looking at what's available from the vendor and speaking with the vendor and understanding what they've done to be able to really sort of save costs up front, because due diligence is expensive, and user acceptance testing can be very time consuming and also expensive.
Yeah. And also,
it was a long answer. I apologize.
That was a long answer.
Favorite subject.
I think, obviously, like Paul mentioned, right? Like the idea here is like, let's identify strategies in which we can, reduce the cost of using eTMF technology. And part of it starts with, selecting and implementing the vendor. And I think that's part of the due diligence, right? Is like, how can I streamline that? Can I leverage any certifications that the vendor has? Can I look at pre-filled audit questionnaires? Can I forego on-site audits that either I might need to pay for, or that I may end up paying for anyway because the vendor will pass it on to me? And is there a way that I can access any other documentation that the vendor is providing to be able to streamline that process? More often than not, if you're working with a reputable vendor, they're going to have all of that documentation ready for you, and you're going to be able to review it and forego some of those sort of more lengthy and costly processes. Paul, you had
two other follow-up points there as well. There's one thing that I think is also very useful, and that's what we call a quality agreement, which the regulators are looking for more and more. And a quality agreement basically defines, well, which parties are involved in ensuring the quality of the system and the protection of the information contained within, and what are the responsibilities of each of these parties. And that's a really useful document to have. And we're more and more now providing that to our clients as the documentation that they have to demonstrate due diligence. And then the other thing that I wanted to mention is, there's due diligence at the initial acquisition of the solution, but also changes happen over time. So, we update software on a regular basis. And so make sure you have a process in place as well, so you can continue to leverage the documentation over time. And it's important that the software vendor provides you access to the change control documentation and the other system documentation or changes to process over time. So you want to have a really good discussion about them with them about that when you're actually selecting the vendor.
Exactly. So let's talk about no, that's great. So let's talk about selecting the vendor, because I think that there's another area here that we can reduce some of the burden and ultimately cost and lower the barrier to entry here. And I think that settles on something that we love doing in life sciences, which is RFPs and RFIs. And I've been dying to talk about RFIs and RFPs for many, many years. But I think, by no means am I saying that they're not a useful tool. They certainly can be a useful tool in projects that have a certain level of complexity or a level of risk that requires you to go in and really evaluate every sort of feature and function that a software provider has, or part of their service that they provide. But if we think about this profile of organization, the smaller company that's maybe looking to use sort of a smaller scoped version of an eTMF system, something lighter, with less functionality perhaps that's initially being used? Do we need to go through that sort of long and complex process that sometimes maybe we also need an external consultant to support us with? Do we need to do that if the scope of the system is reduced? Do we need to go through that if the vendor is reputable and has hundreds of customers that are using it? As you know, all of those things I think come into this. Christina, Paul, would love to hear your thoughts on, sort of the need for RFIs and RFPs as part of vendor selection with that sort of smaller organization in mind.
Yeah, I think that I totally agree with you, Oliver. I mean, if you're thinking about cost cutting or saving costs, it would be the first place I think to to cut in terms of the search for your eTMF vendor. I think a lot can be done today through demonstrations and references as well. If your eTMF vendor is able to provide you with those, and you can speak with other people who are using it similarly to you. It seems that there's a lot of different options that would be able to simplify that process for a smaller organization, and then you could put whatever you've saved there into something else that would bring you a lot more value.
Yeah, right. No, I definitely agree. Getting sort of firsthand references and experiences from others should be useful, because I think you get a lot from that. Because I used to be a consultant. I used to do system selection, and we used to have that that really cool spreadsheet with all of the requirements and all the scoring and all of that stuff. And quite often what would happen is we would get to the end of that process, which, is trying to be very objective, right? And we come up with the scores, and then you've got an obvious winner, but then the team still then says, oh, actually, we just didn't really feel that we want to work with them guys anyway, so we're going to choose this one. So it's quite often it can be a bit of a futile exercise. So I think if you are going to do it, then keep it simple. Like, you don't want to be sending 200 questions in this very complicated spreadsheet, because you're not going to be able to process that information. You don't have time to do that. You're trying to run a startup drug company. You don't want to be spending hours and hours and hours. So I think, speak to your industry colleagues. What are you guys using? Yeah, how is it going for you? Get firsthand experience. Maybe come up with this. You could come up with a simplified list of key features that are really important to you. And even use cases, I think, are better. So describe a use case. So how do I want to use the system for what I need to do based on my reality? And start with that. And I think the goal is, you don't want to be spending $20,000-$30,000 on consultancy fees to go through this really long, drawn out process, which doesn't really give you much at the end, because a lot of it's not just about features, it's also about the relationship and your connection with the vendor. And do you feel that you can work with them, and are they going to be a partner for you? That's really important. And that's kind of, it's not always completely objective. It's also a bit subjective, So,
yeah.
Pinch of salt, I would say.
Yeah, not something that your RFP score gives you either, right?
Yeah, exactly. Difficult to do it in an RFP score.
Exactly. And you're like Paul, you said, like, you're always going to get those individual teams that say, oh, well, even though this vendor scored better, I kind of like the idea of working, like this other vendor has a better culture that aligns with the working culture of our team, or whatever it might be. And then it throws the whole exercise kind of into to fluctuation, right? And it makes it a little bit more difficult. So I think that's really useful advice, is like, if you want to do so and you feel like, you want to list a sort of smaller set of questions, you can, like, if you're going to sign up for Netflix, it's unlikely you're going to send an RFP to Netflix. Like, everybody uses it, so you're pretty confident in what it's going to give you. You're pretty sure it meets your requirements. But if you're getting a new insurance provider, well, you're probably going to ask a few more questions, because it has a different impact on you, and it has a different level of risk. And I think that's the way we have to approach eTMF systems. If the scope is small, there's confidence in the vendor, you've got references, all that kind of stuff, you can keep the level of kind of requirements verification, to a minimum. And kind of leave that to the rest of the team. All right, so let's move on. We've talked a lot about how can we make it more accessible. I'd love to talk a little bit about, we talked about this eTMF Lite a lot. We've talked about the kind of the idea of having a sort of smaller scope to functionality, but what does that functionality look like? And Here, I'm also looking for some engagement from the audience. So if you agree, disagree, if you have ideas on what this eTMF light system should look like, throw it into the chat. Love to see what's going on, but I'd love to throw it maybe to Christina first. What do you think that kind of light, smaller scoped eTMF system needs to look like in terms of capabilities and features?
I think it's, basically everything that the minimum that you need to meet regulatory requirements. So we're looking for, a validated system, a user-friendly interface that's really simple to use, document upload, obviously audit trails, search and retrieval, very important for most small organizations. Maybe collaboration tools and signatures, but again, we see that some small organizations are not heavily using that. And so I think that really it boils down to a very simple list of features. Another thing that is important for small organizations is they might not always be small. So scalability is something that's important as well. You might not want to use these features today, but you know that they're there. You know that you can turn them on when you need them. And so as your organization continues to grow, you want your systems to be able to support that growth. And you can potentially activate some of those features you were not previously using. So a bit of both on that end.
No, I would add, if you look at the reality of most of these kind of emerging or growing, biotech or small pharma, or even small CROs, but primarily biotech, small pharma, a really important need of theirs is easy migration of content, because quite often they'll get to the end of the study and the CRO is like, here we go, this is your TMF, you need to take care of it now for the next 20 years. And they're like, okay, how do we do that? How do we get this into the system? How do I know that what I'm getting is complete? And it's going to be acceptable, if I'm inspected. So having sort of better tools around migration and sort of evaluation of the TMF that's coming in is, I think, kind of useful for those smaller organizations. And it may be that it's a combination of technology and, again, services where you can sort of rely on experts who can actually just look at, this is what the CRO is giving you, just doing some sanity checks on it. Does it make sense? What you're getting, because some organizations may not have enough knowledge around TMF to properly evaluate. Is it going to be sufficient or not? Because you don't want to be in a situation where you brought a TMF in, you've been protecting it for the last 3 or 4 years. You're getting to your pivotal phases, your program's going really well. You're about to do your NDA, and then they're looking at, they're inspecting, and they want to go back to one of these previous studies, and all of a sudden you're missing information. And the CRO is not around, all the people that were working on your study at the time are no longer around. And it's like, oh my God, what do we do here? So it's kind of critical for those organizations when they're putting their TMF in. So let's find better ways of making migration more efficient, more effective, simpler, more cost effective as well, because it can be quite expensive. I know that's an area that we're focusing a lot on, migration, and then even me professionally in the industry, I'm focusing a lot on interoperability and trying to improve and standardize interoperability, because it can be standardized. We do it all the time in clinical data management. Why not in TMF? So that's a really important thing. And then also making sure that they have either the knowledge or access to properly evaluate what they're receiving, so that they can flag to the CRO, this doesn't seem right, I think we're missing this, early on while the people are still there. That's super important. So those are my two additional things I wanted to add to what Christina was saying.
Yeah, absolutely. The chat is on fire right now with lots of questions and suggestions for what this sort of simpler eTMF system will look like. What I'd love to do now is maybe kind of one of the things I think that's tied to capabilities is that there's probably a whole bunch of people on the line here that have in the past, or maybe are today, using and have implemented a CTMS system that has some document management functionality, and are asking themselves, or have asked themselves the question in the past, is this sufficient? Is this what this eTMF looks like? Paul, what are your thoughts there?
I've had that question so many times over my career. So in my opinion, in the vast majority of cases, CTMS is CTMS. It's used to manage a study and track what's going on in a study. It is not an eTMF. And the document management features usually are quite rudimentary. And I use more for sort of managing things like site startup. Because site startup, we know that there's like a whole bunch of documents that are kind of critical that we need to have in place. Those documents live in the TMF, but the TMF is so much more than that. It's a very sort of large group of different documents from all different areas of the business that all need to be organized in a very specific way and managed over time. And CTMS doesn't usually have the functionality or the mission to do that. And so I don't think it's a good idea necessarily to leverage CTMS as your eTMF. You'll also not get things like the metrics that you need to track around completeness and quality and that whole process around QC and all those things that are kind of important to TMF that just don't exist in CTMS. So if you're a small organization, I would actually invest first in TMF before investing in a CTMS, because in reality, you're probably working a lot with CROs, and the CROs have their own CTMS and they actually have their own process as well, and they prefer to use their own process, and that will keep costs down if you allow them to do that. So I don't think you necessarily need a CTMS as a small organization. Now, obviously over time, as you grow, it might make more sense as you start to bring more and more clinical operations in-house. But initially, I would focus more on getting a really good TMF system in place, which will allow you to properly manage your trial master files ready for inspection. And also sort of starting right from the get-go, from phase one, you've already got all of your information really well organized in a TMF. It's also useful, of course, to have all of that information really well organized for due diligence by investors. And let's face it, as an early phase company, you're quite reliant on raising new rounds of funding. And they want to look at your science, right? So they're going to look at your data, but they're also going to look at documentation that's being held potentially in the TMF or in your regulatory system. And so really important to have that super well organized so that you come across as a well-organized organization that they can feel confident in. CTMS won't necessarily give you that. So,
and I guess also from an inspection perspective too, Paul, like would you want is there a risk there that if you've got your full TMF and your CTMS together in one place, if they're coming in and reviewing the TMF, does that run the risk of maybe seeing things that you don't want them to see that's in the CTMS? Or?
Sure, I mean, it's possible. I mean, I think it depends on the organization, but usually, I mean, within the eTMF, we typically have an inspector profile, right, which is clearly defined. You can control exactly what's being accessed, and you can track what's being accessed. In CTMS does contain information that potentially is eTMF relevant and therefore inspectable, but not all of it. And so, yeah, I think you need to be careful about that. If and especially in Europe, they can ask for access, direct access to everything. Usually, I think you just need to be careful. I'm not suggesting that you're doing anything inappropriate, but there's just a lot more stuff you're gonna have to check before your inspection if you're providing access, full access to the CTMS, or you need to be able to find a profile within that CTMS. Yeah.
All right. So let's wrap it up on one last question that I have for all of you, which is really centered on how eTMF or how can eTMF technology evolve in the future to better support the needs of smaller organizations. What is this kind of dream state, this future state? One that, of course, we're trying to architect ourselves as an eTMF vendor, but what does that future look like, for the smaller organization?
I think the bottom line for that is really about being able for them to pay for what they use. We're not trying to, if there's a small organization who's just looking to do something simple, there's no need for overselling or having them implement these features that maybe they'll use 5 years from now. And so really just being able to scale down and accommodate the needs of smaller organizations. Things like adding a little bit more automation, potentially having mobile compatibility, if that's something that's easier for smaller organizations to use. Having integrated training and onboarding like directly in the system, or maybe needing very minimal training and onboarding because of the decreased scope there.
Yeah. Also, things like integrating like micro learning and stuff like that into the environment could be useful, because I think a lot of these sort of emerging organizations don't have a lot of experience in TMF, and they don't necessarily have a lot of time to sit through like a 2-day conference or a big training course. Just having sort of very punctual micro learnings about specific areas. Why am I doing this? And being able to get sort of direct feedback on that, really useful. And then also just making sure that that they understand it's not just about technology, it is about process as well, and making sure that they have the right procedural tools and knowledge in place as well. Super important. Then I think the last thing is really metrics and analytics. Trying to do more with the information that we're storing, because, and this goes for all of our clients in reality, all sizes of organization. But the TMF really is a gold mine of information. There's a lot of stuff in there which we don't really exploit today, because it's difficult to extract. So the more we can extract from documents, or the more we can go away from documents and more towards data, the richer that environment is going to become, and the more insights into what's happening into our study is going to give. And that could potentially, allow for a much more sort of, a much richer environment that gives a lot more information to the clinical team on a day-to-day basis. And they may not even need a CTMS at that point, because they have all the information they need in there. So I think that analytics is the future in TMF world. We're not there yet, but it's definitely something that we should be looking at very closely.
Yeah, absolutely. And what I would add to that is kind of going back to what Christina mentioned earlier around scalability, right? Like, I think it's really, really important that systems can scale as you scale, both up and maybe even down, right? Sometimes things don't go to plan in our organization, and we need to adjust. But that doesn't mean that we're down and out and we're not going to come back to where we were. And we need to be able to scale up and down as our organization does as well. And so I think today, maybe not all of the technology that's available to us actually, allows us to do that. So I think scalability is super important there, to be able to leverage functionality that we might need in the future that we don't need now. And like what you were saying, Christina, let's not pay for things that we don't need, right? Like, clinical trials are expensive enough as they are. Let's try and make sure that we can minimize that as much as possible, so that we can get, all of these amazing, therapies and treatments to patients as fast as possible.
Yeah, I think one other thing about paying for what you need is that, like, if the companies, these organizations are having to maintain, training or validation for a very large feature set, like the resource cost is also very intensive there. So you need to have someone who's following that, right? Who is looking at the changes that your vendor's making to the full feature set, who's training your internal users. And a lot of the time, just the reality that smaller organizations, won't have the resource for that, because they all have a very important day job. So
yeah.
Many of our customers that we chat with don't have IT teams, right? And therefore don't have validation specialists and things like that. So therefore you're relying on external consultants and other, partners to be able to assist you in that, which will always add cost, right? And I think, here what we're trying to do is try and find a path to lower the barrier to entry for smaller organizations, for those teams that are working on the next innovation, to be able to access the tools that are going to help them do that better and help them do that faster. And to be able to achieve that, we've got to rethink the way that we select, implement, and use eTMF technology. Otherwise, we're not going to be able to lower that barrier enough. So, obviously today's discussion, I think, was great to talk about sort of what are the issues when it comes to TMF technology, and is it working for smaller organizations today? I think, I think the general consensus today is that it is working in parts, but we need to rethink really what we're looking at. If you guys are interested in learning a little bit more about some of the things that Montreal is doing in this area, you can head over to our website. We recently launched a new plan for our eTMF product, which is really focused on the essential functionality that's required for smaller teams. So like many of you have mentioned in the chat, that eTMF Lite or sort of smaller scoped system is now available to customers. So if you guys want to take a look at that, you can head over to our website and learn a little bit more about what's included there. Paul, Christina, I want to thank you both for joining me on another session. It's always fun having a call with you guys and jumping onto the State of TMF Live in this format. We do have another session coming up in 2 weeks' time, and then we'll be taking a small break because we've been back to back every couple of weeks. So we're going to take a small break, give you guys a break, give ourselves a break, and then we'll be back with more great content coming soon. So again, Paul, Christina, thank you so much.
Thank you for listening to another episode of the State of TMF, a live event and podcast brought to you by Montrium, leaders in clinical, quality, and regulatory solutions for scaling life science organizations. If you liked today's episode, hit the subscribe button, view the full episode with video on YouTube, and follow us on LinkedIn for more great content coming from Montrium soon. See you next time.